Hi, everyone. Thank you for joining us today. I'm going to give it one brief minute while we allow others to switch over and join the webinar. So please hold for 1 minute while we let folks in. Thank you. All right. Why don't we go ahead and get started? I still see some folks joining. But hi, everyone. Thank you for joining us today. Just very excited to have our Flexible Housing Subsidies Request for Applications webinar. My name is Glenn Sang. I'm the Policy Advisor for Homelessness and Housing at DHCS. Can we go to the next slide, please? So for today's agenda, I'll just very excited to announce, a couple of things. First and foremost, we last Wednesday released our request for applications for the FlexPools TA Academy. This is, free of charge, no cost or anything for the TA. And today's agenda is really meant to overview the RFA process, instructions for completing the RFA, what TA might look like, and then just kind of going over through some of like the timelines associated with the RFA. We'll also be covering, the core functions of a flex pool very briefly, but really just, since we've released the paper and did a prior webinar today, we'll be focused on, the RFA instructions, but there will be a substantive Q&A time allotted at the end of this meeting. So, all that is to say is that, we released the RFA last week, and then prior to that, many of you might be tracking that we also rolled out the revised Community Supports Policy Guide, which is broken up into two volumes, Volume 1, Volume 2. I'll talk a little bit more about that at the end, but Volume 2 of that policy guide will really cover all of the housing-related community supports. So that said, next slide, please. So really today, I'm just very excited that we're joined by our esteemed panelists. These are our subject matter experts and the faculty for our FlexPools Academy. These are the folks whom selected applicants will be working closely with at your local level. So Allison Klurfeld, Whitney Lawrence, Mark Trotz, many of you may have met them in other forums or on past webinars, but this is the faculty that will be conducting the technical assistance. Allison has prior experience with LA Care Health Plan, Whitney Lawrence and Mark Trott's prior experience working for LA County Housing for Health. This team is really adept at standing up the flex pool in LA County and also recognizes the different models and different ways flex pools can be stood up or scaled in different types of models and different localities, whether it's large, medium, small counties, rural counties, etc. So just very excited to turn this over to them. So with that said, next slide, please. I'll go ahead and hand it over to Mark.
Yeah, hello everybody. Again, my name is Mark Trotz. And yeah, I think you've either seen us, many of you, on earlier webinars, or we've been in conversation in small groups. But we're just going to spend one quick moment here just sort of grounding ourselves in the core functions of a flex pool. There may be some people on, in the webinar who haven't seen this before, but essentially, we see these flex pools as a tool that local communities can come together and either expand something that they have or create a new one to help make it easier to house homeless people. And with the launching of these new funding sources from the state, I think the impetus here is to make sure that communities have an understanding of what these are and can receive some technical assistance to help stand them up. So, basically the main parts of the flex pool are it's a great vehicle to braid funding sources. It's easier to do a flex pool when you have multiple funding sources. So for certain activities that one source can't cover down, there's another source that can, and so forth. And I think that will be particularly important as we try to utilize these new state funding sources. Another key feature is that when you have a flex pool, you generally contract with an intermediary, and that entity is the one on the ground really helping getting it done, recognizing often that it is hard for the lead entity or other funders to perform this function. You have a housing intermediary that cuts all the checks, that helps you find the units, that represents the program in the community to the landlord community. And another key feature is this intermediary also is able to develop a portfolio of housing units, and ideally ahead of time, or concurrently when you're housing people. It's much easier to have a group of units in your hip pocket as you're trying to house folks who are eligible for the flex pool. And also, very importantly, this the flex pool also and the intermediary connect to the supportive services that are in the community and make sure that the folks that you're housing through the flex pool and who are receiving this rent subsidy are also well supported by community providers. So those are the core functions. You can also look, you'll see the link there. The state put out a while ago, the Flex Pool Technical Assistance Guide, and there's other resources there for you to check out. So at this point, I think I'll turn it over to Allison.
Great. So we go to the next slide. So I'm going to give a little bit of an overview of the RFA, right? What are we asking for? Why are we asking for it? Just to kind of give you a sense, please do, as we go along, feel free to put the questions into the chat as you have them. We're going to have at least a half an hour for Q&A after we go through our presentation. So what's coming up next is I'm going over kind of what is in the RFA, what's our goals, who's eligible. Then Whitney will take you deeper into the specific questions. What are we looking for? What do we want to see? I'll go over application instructions and then we'll go to Q&A. So feel free to pop those in the chat as you have them and we will go through them. Okay, so the first thing you'll notice about the RFA is there are two pieces. This slide is about part one, the Flex Pools Academy, right? This is about helping TA recipient teams, so groups of organizations working together to get support from me and Mark and Whitney, and we'll phone a friend as needed to bring in others, as well as support from DHCS to try and do a mix of local and all-team activities. So why are we doing this, right? One thing you might need help with and need TA support with is visioning, right? What do we want this flex pool to be, or how do we want to strengthen or formalize our existing flex pool so that it really works for Behavioral Health Services Act, transitional rent, and all the other new opportunities in our very uncertain landscape? Maybe it's actually about going deeper into your funding sources. How do you braid them together exactly? What should you buy with what? What's that sequencing look like? Maybe it's actually working on your funder and your partner relationships with the lead entity. What does your MOU look like? How is that formal and informal? What's your governance structure? And I saw Melanie's question in the chat. Maybe it's about procurement. Actually, the TA can be about, okay, well, how do I want to set up my RFA? Who can I potentially engage? What would make a really good applicant for my operator, and what would make maybe not as strong of an applicant? And then another thing that we can do is to help support the development and the implementation of operational processes to launch services, right? Because it's not enough just to have a flexible operator. You have to make it work, and you have to invest the time, the lead entity, the operator, the partners and funders, and your continuum of care and public housing authorities. You all need to be coming together to make this thing work to house and retain housing for people experiencing homelessness. So that's kind of what you might be focusing on. There's a lot more detail on that you'll see in the RFA. So if you want to apply, what are you signing up for? That's the box in gray. What does it mean to participate fully in the Flexible Activity Academy activities? So there'll be a kickoff, likely in person with the flexible faculty, monthly coaching calls, and about 3 all-team meetings over the 2 years. And just you'll see this throughout, but we will say competitive applicants, you're going to meet the criteria, but there's also going to be an emphasis on how are you thinking about making BHSA housing interventions and transitional rent really work well in your community. So next slide. That was part 1, academy, about learning and kind of coming together, like that's the talking and thinking and doing work. Planning grants, there's a little bit of money available, which is great. So the idea is that the planning grants go towards the efforts of the whole FlexPool TA recipient team. So both the applicant, and we'll talk about who's eligible in a sec, and the other participating organizations. So somebody applies on behalf of the whole team. And what could you buy with this money? It's of up to 150K is what's planned. So there'll be costs for staff or consultants. Maybe it's the first year of your staff person for the FlexPool or consultant to really help you with the heavy lifting, while the academy kind of helps you with the more thinking and planning. Maybe it's supplies and materials, maybe it's meeting costs, maybe it's the community and provider engagement, because if you want people to show up to your meeting and be engaged, perhaps you should feed them some snacks. Just a thought. Maybe it's travel, because we have our 3 events to come all together. It's, getting your staff there, but also travel, maybe to visit other parts of California or other regions to learn about things. Maybe it's technology, maybe it's retrofitting or buying a new system to track the different spending in a flex pool. There's a lot of IT that goes into making that successful. Or maybe it's one-time startup funds, having a little bit of a reserve to pay out of, so as your other reimbursements flow in. So that's what the planning grants are. Again, 150K. The awardees are expected to participate in activities, and the grants will come out in 2 payments, 70% at your initial award, and the last 30% in 2027 with your final progress report. Okay. So if we can go to the next one. Okay, so what's the timeline? So right now, RFA is open. It was released last week on Wednesday, and it is due Friday, June 13th. So we'll get your applications in mid-June. Notices will go out probably at the very end of July to who was awarded for the planning grants and the TA Academy. And then we'll stagger the starts. Some folks starting in August, some in October, and some in December. And then it'll be that monthly, sometimes a little more frequent, sometimes a little less frequent, meetings until spring 2027. So why is it so long? It's because we want to give you the time, not just to vision your flex pool, but also to go through procurement, right? That's 6 to 12 months of your life, kind of minimum in most places, between when you start working on it to when you have your contractor set up. And then you want a little time to actually build those operational processes together. So that's the idea behind the 2-year time frame. Next slide. All right, so this is a little more on who's who. You're thinking about applying. Do you meet the criteria, right? DHCS is going to select up to 10 teams for the Flexibles Academy, and likely, so up to 10 Flexibles planning grants. There'll be a lot of overlap there, we imagine. The blue on the left is who can apply for the Academy. And again, there's more detail on this in the RFA. The darker color on the right is who can apply for the grant. So let's start with the Academy first. That's where you should start. You should be the applicant is the organization who is already or is planning to be the flexible lead entity, but they're going to apply with their team saying, hey, I'm the team, it's my lead entity. If you have an operator or know who your operator is going to be, have them apply with you. They're part of your team. But if you don't know who they are yet, you're pre-procurement, right? They're not on your team. So that's optional, right? It's only if applicable. The third bullet is you have to have at least one team member who is from a local managed care plan or your local county behavioral health agency. The ideal is both, right? Especially with that focus on making transitional rent and BHSA housing interventions work. Let's say, though, that you are that county behavioral health agency. Okay, you've crossed it off the list yourself, and maybe you can bring your MCP partner in. The last criterion is you have to have at least one team member who is a current or intended funder. So, okay, let's say you yourself are the county behavioral health agency or the MCP, right? Like you fulfill that because of transitional rent and BHSA housing interventions. But if you're not, you need at least one of them or somebody else who's going to be putting money in, right? Because flexibles need money. So the first thing you're going to think about, right, is who's that flexible academy and who's the team. And then the next thing is to think about who can apply for the Flex Pools Planning Grant, right? So the applicants, because of our funding source, must be the behavioral health agency or a tribal entity, and they have to be intending to participate in the academy. They could show their intent in two ways. One is they're themselves a lead entity. That's easy to know. But it is perfectly fine and wonderful. It's also great if you're saying, hey, I'm not the right person to be the lead entity, but I'm on the team. I submitted a statement of support with name of lead agency who's, the lead entity in your community, right? And then the last thing to note is, right, you don't have to apply for the grant. If you feel like you only need the TA, you don't need the 150K, or it's sort of, it's not the right fit for your group, right? Maybe you apply only for the academy. But, I think, but to get the grant, you also have to apply for the academy, right? So you can have just the light blue by itself, but you can't have the dark blue without the light blue, if that makes sense. And I've seen some questions. We'll answer those when we get to there in a second. Please do keep them coming in the chat. That's really helpful. All right, next slide. Last thing about kind of application overview. So a little more on this lead entity, right? Who should be applying? The ideal is that the lead entity is going to really meet all of these criteria. These are ands. You have to have every single one to be that lead entity. So the first thing is you have to be planning to do a flex pool. Either you're launching a new one or expanding your existing flex pool within the next 18 months. So this is not theoretical. This is, soon. The next thing is to demonstrate your leadership support within your own organization. So maybe that's your agency director, your CEO, someone who's very high up in your organization saying, yes, I want this to be, they're a member of the team. I want this to be something my agency does and leads. The third thing is having an established role in the local homeless services, housing, or rehousing system, right? And including not just that work in the homeless services system, but a history of serving Medi-Cal members and or individuals with serious behavioral health conditions, right? So we don't want someone kind of parachuting in from somewhere to be the lead entity. We want someone who really understands and is embedded and is a part of the system, right? Becoming that local homeless services, housing, or rehousing system. So maybe you're a county behavioral health agency, but you're a part of your COC board, or you work in partnership because of your MHSA housing interventions. You've got that experience. Maybe you're a county homeless service agency, or you are the COC lead or a public housing authority, or you're a managed care plan during housing related community supports, right? There's lots of ways to be part of the system, and we want you to tell us about it. The next thing, and we'll go into this in more detail, is you got to demonstrate support from all intended members of your TA recipient teams. So we want statements of support, right? We have an example, like they can be super short, but we want to show that they are really on board. They said, yes, I'm in, I want to work with you. And you yourself as a lead entity, you got to demonstrate your commitment to championing the flex pool, right? You are going to be the ambassador. You are going to be the cheerleader for this program. It takes a lot to get a flex pool up and running. So we want to see that you're ready to do that. One key thing as you're thinking about this application is that DHCS will review only one application for each actual or intended regional flex pool, right? So you got to look around and talk to your partners, probably as you're talking about statements of support, to say, hey, I think my agency makes the most sense to be the lead entity. I wanted to check, were you thinking about that too? And if you find in your community 2 agencies wanted to be the lead entity, talk about it, right? That's a really good thing that'll show that you're on the path of planning that out. Since only one's going to be reviewed, you have to think about and decide who's really going to be able to lead the flex pool in your community, who's the best as the lead, and who's the best as a partner, right? It's not don't participate, it's which role is right for each of you. So that's a little bit of an overview of the RFA. Again, much more in the document. I see some questions coming in. We'll be replying to those in the Q&A section. But right now, I'm going to turn it over to Whitney, who's going to go through some of the questions and what we're looking for in each one.
Hey everyone, good afternoon. Whitney Lawrence. I'm a consultant on the project. We can go next slide. Okay, so I have like the great pleasure of just reading slides off to you. I will say though that I did re-review the RFA this morning. I do think, I think it's pretty clear as you walk through it, sort of what it is that we're asking of you. So after you sit with us here today, before you start to dive in and plan, I just encourage you to read through that full application, both sort of sides of it first, and then kind of dive in. So there are 3 sort of major sections to the Flex Pool Academy application. The first is the narrative and application questions. Again, this is the lead entity who is responding to these questions, ideally after some level of conversation, some very light planning with some of the key partners at the table. So what we're really trying to learn in the narrative section is, have you given this some thought in your community? Do you have a sense of what a flex pool is going to do for your community? Who are your key partners? Have you engaged with those key partners? What does your relationship with those key partners look like? Do you have any funding that you're looking at to bring into the flex pool? And then we also want to know a bit about the lead entity. Have you done housing work before? Do you have experience administering rental subsidies in your community? How sort of like plugged into the quote unquote mainstream rehousing or homeless services system are you as the proposed lead entity? So successful applicants will demonstrate capacity and commitment to serving Medi-Cal members and or individuals with serious behavioral health conditions. You'll have a strong vision for a flex pool that aligns with your local landscape. We are, I think, as we're emphasizing throughout, very interested in how you're thinking about transitional rent, BHSA housing interventions, and any other local sources that you might bring into the pool. We're interested to know about sort of like what kind of support you need from us for TA. Some of that is about us being able to plan our efforts and make sure that we match you to the right consultants. And then we also really very interested to see evidence of your existing partnerships or your intent to partner. We're particularly interested in county behavioral health. How are things looking with your MCPs? Are you guys in relationship now? Are you in conversation? And then also very curious to know about what your relationship looks like with other lead organizations in this landscape. So that's going to be folks like your COC, your public housing authorities, and every community is unique. So you might have another sort of like key partner who you are saying, we also have this key partner at the table, and they're very important to our landscape here locally because of X, Y, and Z. And that first section is worth 20 points. And in the application, you'll see we have some really specific sort of like word count maximums. Those are both to like standardize things across, but also to give you a sense of sort of like the length that we're looking for. Because we do want to understand what you're thinking and where you're at, but we also wanted to make this an accessible opportunity. We can go next slide. So we also want to know about your TA needs. We want to know, we'll ask you to identify kind of like your top 2 or 3 areas where you know you'll need support. Don't stress. It's not like you list those top 2 or 3 and we're not going to talk to you about anything else. That's again, just to help us with some of our planning across the cohort. We also want to get a sense of when you might be ready to start TA. And some of that is about our planning, because we do think that we will likely need to stagger the starts of different communities in either the summer, fall, or the winter of 25-26 based on where you guys are at. And we'll go next slide. Statements of support. So we do ask for statements of support from the leadership table of each of the organizations who are going to participate in the team. These can be so simple. I'll be totally honest, we went back and forth on this in the planning of this RFA. So we did even provide like a very simple 2 or 3 sentences template in the RFA. You don't have to follow that template. We provided it simply to show you, hey, we're not looking for like a full-blown multi-paragraph letter of support here. We just need to see a short statement of support and a signature of leadership from each of the organizations on the team. And we'll go next slide. Okay, so that was all for the academy, and there are sort of like 2 components to this RFA. For the planning grant, there is a separate set of application questions, and there's also a budget and a short budget narrative that needs to be completed. We can go next slide. So planning grants should describe how you intend to use the planning grant to achieve the desired outcomes. You should be able to clearly demonstrate sort of what is your use of the planning grant? How are you going to use that to overcome barriers, to either create a new flex pool or to strengthen either a fully blown existing flex pool, or to strengthen some of the components that you have of a flex pool in your community. I think one thing we're looking for in the planning grant is to see that you have clarity about sort of like the near-term goals and planned activities. And then also we just want to see if you, how the planning grants will support the activities of the academy. We can go next slide. So we aren't asking folks to submit a high-level budget and a brief narrative. We want to stress this budget is non-binding. We really just want to get a sense of where you think you might spend the planning money. You can see the template there, and then you can see brief. When we say brief narrative, we do mean brief. There's just that little box next to each item that you're going to spend money on, where you will briefly justify sort of the cost and how it relates back to your objectives. We'll go next slide. And I think I pass it back to Allison for this.
Yes, I get to tell you. Okay, so you've done all your work, you've thought about it. How do you actually get this to us, right? Or really to the DHCS team. So the application and the attachments along with submission instructions, right? It's all in the RFA. So the link to the Housing for Health website is there. It's also in the chat right now, and we'll email it out to everybody again. You can only apply electronically, right? You can't hand deliver it, you can't mail it. We hopefully made this pretty easy, right? You submit it as an email to flexpools@dhcs.ca.gov with the following, right? Like your subject line should be RFA submission, and are you submitting for part 1, right? You're the lead entity. Maybe separately, your county behavioral health department or your tribal entity partner is submitting for part 2 and by your name, right? So we want to know it came from you and what are you applying for? And then the RFA actually in the attachments A and B, they just have the content. So you can just copy those into a Word document or, your favorite word processing software. Copy those into a document, put in the answers. It's got your name at the top, it's got your email, and just email those as attachments. One thing to know, of course, is that the deadline, one thing to know just on the attachments, right, is there is an instruction, please provide your statements of support as separate attachments. So probably, right, if you're doing the planning grant, you have your application is like one Word document with your answers to all the questions. And then you have letter of support, our agency, letter of support, county behavioral health partner, letter of support, the local COC, whoever it is, who's your partners, right? But hopefully that should be pretty easy where it's just emails, attachments. The deadline is the deadline, right? Please do not email at 4:59 p.m., right? Like you don't want to be sad if your computer freezes at 4:59. I believe in you and I believe you can get this in sooner, right? So that's the deadline. So it's a Friday, June 13th, about 5.5 weeks from now, to submit this in. And hopefully it'll be, again, pretty easy. That said, if you have disabilities or any questions, if you need alternate services, you can just email to request. And if you have questions, right, we're going to try and cover all your questions right now to understand what would help you be really ready to apply for this application. But maybe we missed something. You can also email the flexpools@dhcs.ca.gov with additional questions to respond to you. So that is what we want to see. Let me go now to Glenn to lead our Q&A section, and I see some great questions coming in already.
Hi, everyone. Thank you, Allison, Whitney, and Mark for the overview. So hope that this information has been valuable for everyone. We have 30 minutes left on this webinar, so encourage folks to come offline, ask questions. This is really your time to ask any of us questions about FlexPool model, the RFA process, etc. Also recognizing there's some questions in the chat. So while folks are thinking of questions, I'll take the first one. This is from Megan. What funding streams can contribute to the pool besides BHSA and Medi-Cal transitional rent? Great question. First, I'll say that, DHCS, we have been rolling out some major initiatives to address the housing needs of our Medi-Cal members and members with behavioral health conditions as well. So we do have a strong focus on wanting to see those initiatives really braided together to the extent that it's possible at local levels, but also recognizing that there may be other like state programs, local programs that have some kind of rental subsidy component. I would generally say that, within those program guidelines, those could be potential options as well. We are also looking to put together a funding source chart or some kind of resource to provide out there for other programs, as we are working across the board with our state partners to identify what are other potential sources and what they can be spent on as well too. So hopefully more to come on that soon as well. We'll be looking to release that and we'll notify folks through our usual channels. So there's a lot more potential for flexibles, and the idea is it takes those other perhaps smaller rental subsidy programs and really make it go as far as it can by braiding it in with these other ones too.
And
Um,
just
Go ahead,
adding,
Allison.
I'm also going to drop a link into the chat to another state resource. There's this document called Putting the Funding Pieces Together. It's a little bit out of date from 2023, but that's a state resource that's generally geared towards sort of housing in general, not flexible specific. Just if you want something that's out now before those flexible specific resources come out later this summer. So I'll drop that link in. It includes like a lot of different funding sources and what you could use them for. And maybe then you could break them with transitional rent and BHSA.
And just to add to that, there may be other agencies in your community, they may not be thinking this is rental subsidy money, but they are looking at trying to house their participants, whether it's the healthcare system or the criminal justice system and so forth. And they're looking for a way to tap into a mechanism to do it. So I think, look around broadly for people who are trying to house people and where housing isn't their specialty, but they have money.
Great point, Mark. Allison, can I kick this question to you? It's a little bit more process question. It comes from Nicole. Hi, Nicole. It said, are we allowed to submit a single letter of support signed by all partners?
I think that would be fine. As Whitney mentioned, right? Like the thing we most want to come out of the letter of support is to see, right? Like not so much like what words are they using to support, but like their signature and agency logo, right? So I don't care if that comes to me on 5 pieces of paper. And I don't, when we talk with Glenn and Alana and others, like that's what we want to see, whether it comes on one electronic piece of paper or 5, that's fine. So
yeah, and I think to piggyback off of that, our goal, we do have to have, of course, some type of process around this, a selection process, but we are trying to also make this as low bar as possible too. So we don't want folks overthinking anything. But I think as long as it hits on the general themes of like partnership, who's at the table, for example, also understanding that, we may not have it all figured out, and that's exactly what the TA is for. So that said, another question. I think this is from the tribal entity. Sorry, I don't want to try to pronounce the name incorrectly. If you want to come off mute and state your question, that'd be great.
there are 2 folks in the chat who have from tribal entities.
Okay.
I see one about which tribal department should apply, but do you mean?
I saw Champagne had the hand up, I think. Sorry, I didn't want to try to pronounce the name.
Thank you. Yeah, this is the Tobago Champagne representing Dry Creek, Rancheria Banapomo Indians. Our question really is it seems like this was written more for our county collaborative partners versus more for tribal entities. So I realize tribes are eligible, but understanding tribal government systems, I think going from the comments I seen from another tribe, is our systems may be we're government, so we have multiple systems, right? We have behavioral health, we have social services, housing, and those would be our normal partners, along with potentially, if we're in consortiums or things of that nature. I guess just need more clarity on, when you're looking at this for the region perspective, when you're looking at it for systems perspective, are you thinking about that you wanted to see tribes partnered with other tribes, or if you're thinking about forcing us to kind of sit more second chair to counties and asking permissions for them to be part of the flex pool on their lead. I think I guess it's not the latter.
Yeah, no, it's a great question, and we haven't gone as far as to prescribe that in great detail. I think for our department, one of our priorities is administering transitional rent and BHSA housing interventions for those counties that are using it for like rental subsidies, for example. I think for the tribal considerations, and then Whitney, Allison, Mark, please feel free to speak over me on this. I'll just say, like, I think it'd be important for us to just chat offline about it, just to learn a little bit more about how the dynamics may work with your plans in your area, counties as well, too. Would just love to learn more about it, but we're not, being overly prescriptive in that regard as of right now, too.
Yeah, I don't have much to add, Glenn, I think, yes, that's right. And I think we would be happy to talk offline if you and Dave want to get together sometime and just talk some of this through. I think somebody else in the chat, Michael, also asked if other tribes if a tribe has done a flex pool, a flexible housing subsidy pool. And I think the short answer to that question is not that I know of. I do think that there are some tribes that have some components of a flex pool, Michael. So actually some of the stuff that Dry Creek is doing is very flex pool like. Some of the stuff that Northern Circle Indian Housing Authority is doing is very flex pool like. But we'd be happy to take those conversations offline too and think through what this can look like in your landscape, knowing that that emphasis is admittedly on operationalizing transitional rent, operationalizing BHSA, but I think we're really open to the conversation.
Thank you, Whitney. Next question I have is from Brian in the chat. Comment was made about including travel in the budget. Will TA recipients be required to travel to TA activities? Short answer is largely no, not a strong requirement. I think we are looking at ways where we can have certain convenings. I think it'd be great if there's some in-person, but we haven't fully fleshed all of that out. But this is not like, we're not going to send Whitney, Allison, and Mark all over California. So I think there will be, strong virtual presence to this too, as, many of us are still very much in a virtual work environment too, generally speaking. Allison, did you want to add on to that?
Yeah, I think, totally agree. One of the things you'll see though is that there is the plan to do probably like 2 to 3 all team convenings, because it can be nice, right? Like I think so many of the problems you're trying to solve with flex pools are local, or like, okay, how do I get this county board of supervisors person and county council to sign off of it? Or how do I work out my referral pathway, right? Like so much of this is local, but it also can be really helpful to just hear, right? Like across communities, what are they doing over there? How could I learn from it and get support from my colleagues? So the idea is to have probably 2 to 3 one-day, in-person events. And that would be the plan if you want to include some of the funding in your budget for that. We don't know where we'll have them yet, and we may do quite a virtual component as well, but wanting to just have you be aware in case that's helpful for your planning grant budget.
Another question in the chat, it's already been answered, but I'll just voice it over, just confirming that for the planning grant, yes, you do have to be part of the TA Academy. Another question, will we choose more than 10 applicants to receive the TA only? We're kind of taking a wait and see approach on that right now. We're curious to see the number of applications that come in. I think if it starts getting to a certain number, then we'll have internal discussions about, potential expansion beyond the 10 that are selected. Great questions, everyone. Again, would encourage folks to come off mute or pop more questions in the chat. This is, again, really your time to ask us any questions. And of course, we're always happy to offline to talk more about the process or go over maybe some of your own local considerations as well, too.
I see a follow-up question from Brian on the convenings. So there's kind of 2 different things. There's a local kickoff where we come to you. The 2 or 3, though, all team convenings, I don't know, probably at least one will be in Sacramento, right? Maybe we'll try and do one SoCal so that not everybody has to go both places, but that is a sort of you come to us or everybody comes together rather. So those all team convenings will be probably travel within California. And likely Sacramento is at least one, if not two of the three.
One thing I would highlight too, as folks are preparing applications, we are really wanting to ensure that the leaders of your communities are, heavily involved in this effort. We want to make sure that this really goes towards the actual, standing up or scaling of flex pools too. So I'd put that out there as well. Another question to address is for the planning grants, the RFA notes that the planning grants must be encumbered or expended no later than June 30th, 2027. What is the definition of spent and encumbered? Just plainly speaking, all funded activities must be completed by June 30th, 2027. I think a lot of folks are probably envisioning like using the funding, for example, to bring on a local consultant to help pull that work together too. That's just like one example. There's a question, did I hear correctly that we should already be providing transitional rent via behavioral health bridge housing to qualify to apply? The answer is no.
I think I saw one other from Stephanie Rubio. Are there any additional points that an entity could earn outside of the points on the RFA? And I think the answer is no to that, right? What's in the RFA is in the RFA. That's the points.
Correct.
And then just to say out loud to Michael, we'll reach out in the next couple of business days. We have an internal meeting tomorrow, so after that, we'll reach out to some of the tribal folks on the call who have expressed an interest to have a sidebar. Did we answer the question about Stephanie Rubio's question? Okay, we did.
And again, just would like to emphasize, for this application, we recognize that some partners may be flex pool curious, not, and I think that's part of the goal of the TA is to try to pull this together. And part of a letter of commitment or support, we want to try to encourage parties who want to learn more about it as well too. So we understand that different localities may be at different points in the planning for flex pools. So just don't let that be a complete deterrent. Of course, we would love to have everybody at the table saying, yes, we got all this, we're doing flex pools. That'd be fantastic. But we also understand that, hey, this is a new model for administering rent, and we're interested, not sure how, have a lot of questions. We want to do it. We understand that those are all factors at play and would still encourage the TA. And I would even venture out to say that's probably a strong point for TA that's needed. Another question we had is can the planning grant be used to pay rent? The answer is no. Planning grants cannot be used to provide direct rental subsidies. Planning grants are to support the efforts of the FlexPool TA recipient team, including the applicant and other participating organizations. Any other questions from folks? So the planning grants, they're really not meant to be used outside of more than just like for the planning of scaling the flex pools. So it's not meant to like go towards landlords or other uses of that nature. It's really just to help, stand up for localities like bringing partners together, for example, administrative functions. And again, these slides, this will all be posted to our website shortly after this webinar is over. Another question is, if we have a pre-existing flex pool, are we eligible to participate? The answer is yes. Strong applicants with a pre-existing flex pool or elements of a flex pool would discuss why they need TA and or how a planning grant would help them incorporate transitional rent and BHSA housing interventions to scale that existing flex pool or address other challenges. Any other questions folks might have?
I think there's one from Lisa from Partnership. It's just saying that the funds could be used as part of the reserve for the flexible. Lisa, are you asking maybe just like what does that look like, or since it's not paying rental subsidies? I'm just not sure we understand your question. Oh, just confirming. Yep, part of the financial reserve.
You know, Alana, are you online still? You might be able to answer that one better. I hate to put you on the spot, or we can take that back. It's about the use of the BB planning grants being used for like landlord mitigation or as a reserve. Alana, can I kick that one over to you? And
Yeah,
definitely okay
sure.
taking offline if need be.
No, it's fine. Yes, the planning grant funding would be intended to be for state operative and administrative costs. So essentially it would be all aligned for the administrative and planning grant work, but this funding would not be directly eligible to be used for rental assistance or other housing services.
Thanks, Alana. Another question about path cited. We would probably wait and see, again, that other stream of path cited funding. We'd want to see what the applications come in and how the potential uses are to see how they line up. So we don't have guidance on that as of yet.
But one thing I'll flag is we intentionally, right, like the budget is non-binding. One of those reasons, right, like the eligible and ineligible cost, that's going to stay the same. But because of that path cited, right, you don't know yet what you're going to get funded for. There might be some overlap. So that's one of the reasons, for example, that the budget is non-binding, even though the eligible and ineligible uses stay the same. So basically, like you can change the budget depending on your path cited as long as it stays within that.
Yeah. The budget for here is really to give us a sense of how localities intend to use the BB dollars. All right, great questions, folks. Again, these slides will be posted to the website shortly following this webinar. Again, just keeping it open. If other folks have questions, please feel free to come off mute. This is really your time to ask, myself, other DHCS colleagues, and our faculty here, any questions you have on flex pools, be it about the model. No bad questions here whatsoever, or the TA. I think there was a question about what if neither our county behavioral health or Medi-Cal managed care plans are interested in participating in the flex pool, would that preclude us from receiving TA? I would say having both partners is preferred and makes you a stronger applicant, but only one of the two is required. I'll also just say and add that, we understand that perhaps those partners, again, to my earlier point, might be curious about the flex pool, but unsure how they would function in the flex pool. Recognizing there's more than one type of model of flex pools, but if they're at the table and they're wanting to learn with the potential of participating, I would highly encourage that as well too. So this is not, a flex pool for the TA. This is not saying like they all have to be participating in the flex pool and have committed dollars, but I think it's also saying, yeah, they're interested, they want to be at the table and understand how to, for example, administer transitional rent through it. They're just not sure how. And that's exactly what the TA is intended to do.
Jesse Ferguson, aren't you supposed to be on vacation? Right now? That is a good question though. Would we still want Allison, Glenn, that kind of like very specific letter of support from maybe like the behavioral health arm of HHSA if they're like a super agency?
I think we'd want to see they don't have to be the lead, but they, if it's showing that there's, maybe it's showing, maybe you have one team member who's from that part of, from that part of the agency, or maybe it's the kind of sub director or, leader under that team would be helpful. You want to show their support in some way, I think. But I don't know that you need a separate letter of support if it's from the same agency, as long as they're participating actively.
Another question from Dylan, will applications be prioritized based on whether the applicant is standing up a new flex pool or expanding an existing flex pool? I'd say not necessarily. Allison, Mark, Whitney, please feel free to speak over me. I think we're going to look at like the TA needs mostly, and who's at the table, and what's again, as DHCS, we're rolling out some major initiatives with transitional rent and the BHCA housing intervention. So we do have a strong focus on the potential uses of those within a given flex pool. But again, I would probably go back to saying that it really would depend on the TA needs there. And the commitment from partners, perhaps, too. Another question, is there a minimum number of partners under the flex pool regional approach besides behavioral health? No. The answer is no on that. Again, just going back to the application, we just want at least one of the county behavioral health or the Medi-Cal managed care plan as part of it. That would be the minimum there. And assuming for regional approach, that might be smaller rural counties, for example, please highlight that for us. And, we're very interested in like how a model would work in those kinds of localities too. Hence, great opportunity for TA. Are DSS agencies being operators of flex pools? Allison, Whitney, Mark, I kick that one over to you.
I think they could be. Most of the examples we've seen, there's county behavioral health, there's county either like homeless or housing departments. There are some COCs that do it. There was one MCP one that's different. They sort of changed format. So I haven't seen it yet, but that doesn't mean they couldn't. It's more about, right? It's not so much who can as sort of who will and who brings that in their homeless services and that capability and expertise.
Yeah, I would just add if there's energy within that department and, a leadership capability, there's certainly nothing wrong with it. And there may be some flexible funds that they can add in and then reach out to the behavioral health entity as well as the MCPs.
And for operators, that could also be a great point of emphasis for TA too. I think the main thing is like how quickly can the operator push dollars out to landlords, for example. That would be a key driver, and who's actually the most functional operator for your area too. Another question, with transitional rent being for up to 6 months per demonstration period, could housing assistance funds be used to cover rental subsidy for a longer period of time, both being managed through the flex pool? Not sure if I'm totally following that question about housing assistance funds. Allison, do you have a sense on that?
I wonder, Eugene, if you're asking about like what can I do with this planning grant versus what can I do with other money? So as Alana said, with this planning grant, we can't pay rent with it in this funding. It's for kind of more of those like startup and operating costs and technology and consultants or staff, right? This money through this RFA, not designed to be housing assistance. It could be a reserve, but not housing assistance. However, I think the idea you might be asking about is the transitional rent. The goal of the department, as I've heard it, is to have many folks move from transitional rent to BHSA housing assistance for rental subsidy for a longer period of time. And then a flex pool could be one way to to operationalize that, but it's not the only way. So that's what I think maybe clarifies that. So it's a great question, maybe not specific to this money, but more general money.
Yeah, sorry, just to say that again, like another way, Eugene, if that is what you're asking, a flex pool is a great sort of like vehicle to sit and do that little trick where you're turning off one funding stream faucet and turning on another funding stream faucet. It's sort of like one of the beautiful use cases of a flex pool. And that could be transitional rent and to BHSA money. If you have both of those monies playing in the flex pool, it could be transitional rent to beautiful other funding source that you have in your flex pool. But that's sort of like exactly the problem, one of the problems it's meant to solve.
All right, we have about 2 minutes left. There's one last question. Did I hear correctly that it was only 10 applicants in the state? Does that mean one would cover more than one county? Potentially, there could be, like the regional approach, for example, that covers, multiple counties. Again, I'd say work with your local partners, identify who would be the lead entity to submit the application. Once we start intaking the applications, we will assess the volume of applications we have. If there's strong interest, hey, yay, that's great. And we will talk about that when the time comes, when the applications come in.
And just to clarify, like these flex pools, who's selected, it won't cover all of California, right? There's sort of, I think, and you don't need to have, like, you don't need us. Let's say, you apply, you don't get selected, like that's too bad, but you can still do a flex pool, right? This is just sort of one opportunity to help advance this concept that the state is doing. And there may well be other flex pools both during and after that people are able to do.
All right, 1 minute left. Can we go to the next slide, please? So just a quick plug for folks here that thank you for staying on. I realize some folks dropped off. On Wednesday, we will be having a webinar on volume 2 of the community sports policy guide that'll cover, all of the refinements we've made in that, including the new transitional rent as well. And then on Friday, that'll cover the other community supports for volume 1. So 2 webinars there. Please look at the links, encourage you all to join. Next slide, please. Understanding there might be more questions, please feel free to reach out at flexpools@dhcs.ca.gov, and please visit our Housing for Health website for more information. That said, I think we're right at time. Mark, Allison, Whitney, thank you so much. Do you have any parting words for folks?
It's really exciting to see you here, right? Like you can do this. I mean, we can do, sorry, this is my one plug. We can do this together and you can do this. You can do this with us. You can do this without us. There's a lot of different ways to do it, right? Because you have a big task ahead, setting up transitional rent and BHSA, but like we're going to house some people and very excited about that.
Sounds great. Thank you, everybody. Thank you for your time. Looking forward to seeing your applications.
And if you stay on, I'll put the links in the webinar in the chat for the next one super quickly for those webinars. Give me one
Thank you,
second.
Allison.
Well, I'll try and do it. We'll see if that works. Okay, both webinars are in.